I'm a proponent of a holistic approach to health system strengthening, and that includes a set of activities and strategies that produce permanent systemic changes to the health system. And when I say permanent and systemic, I mean there are activities or strategies that change how the system fundamentally operates. So just to give an example to illustrate that, to address maternal health, to improve maternal health, we can purchase essential maternal health drugs, figure out how best to distribute them to facilities where they're needed. But that's not a permanent fix. A more permanent fix, a more systemic fix, would be putting in place budgets where they're needed, finding sources of funding for these essential drugs, putting in place ways to track stockouts in facilities and having a way to respond to those stockouts, making sure managers are empowered to respond to these stockouts, and finding a way to hold them accountable for medicine supplies that they're responsible for. A strong health system is critical to ensure that we can introduce, scale up, and sustain high-impact interventions for RM and CAH. These are the interventions that will save lives. But these interventions can't be delivered in isolation. Many of them can't be scheduled. They really require an alert, responsive health system. I think the global health community needs to recognize that the health system strengthening agenda is key to the global health agenda. To some extent, that's already happening. So, for example, health system strengthening is incorporated into the Maternal and Child Survival Program. Or USAID several years ago published a vision for health system strengthening, which is sort of a guidance document for addressing health systems issues within global health programs. Although we all know rationally that we need to improve the health system, I think it can still be a challenge for someone working on a family planning program or designing a malaria program to try to figure out what is it that I need to do, how do I address these complex challenges. So I think what's really needed also is more opportunities for these programs to work together collaboratively to try to address underlying health system issues. Strong partnerships are very important to improving health systems. The challenges are so large that none of us can address it by ourselves. Maybe the most important partnership is that with national and subnational leaders who are really committed to making improvements in their own health systems. They are our change agents in country. Also important are partnerships between collaboration between external partners to make sure that their goals are aligned, to make sure that there are synergies between their work. But I think the thing that we should always remember is that the only people who can actually change the system are the leaders and actors within the system.